Good evening, guys. Today we are going to see ECG. Okay, main PYQs references. See, first most common. So for AFib, atrial fibrillation. So there will be no P waves because atria is always contracting, right? So there will be no clear P waves. Sluttery like this, irregular, small. These are all P waves, but it's no clear regular P wave. And QRS. It's a normal QRS. Okay. Then the second, it's a atrial flutter. Right. So here, wait. See, atrial flutter, right? So here, sawtooth waves like P waves. These are P waves, but it will be like not in like atrial fibrillation. It will be regular, and it also in like 2:1, 4:1 like that. It's very regular, right? And like short tooth waves, sharp edges like this, and QRS, normal QRS. Okay, this atrial flutter, but not a single P wave. It will be more than 2 or 3 like that. P waves will be present in atrial flutter. Next, paroxysmal supraventricular tachycardia. Here, this is also ventricular tachycardia, but it is above the ventricle. Okay, so it also conducted through. There is a rhythm is conducted through normal pathway. This bundle of is Purkinje fibers, normal that pathway. So the QRS will be narrow. But here no P wave because it's a tachycardia, no, so no P wave. So QRS, which is a narrow QRS complex, a T, but no P wave. Okay, this PSVT. Next, ventricular tachycardia and ventricular fibrillation. The main difference is that is ventricular tachycardia, the QRS is broad, both are broad QRS, but this is regular, this is irregular. Okay. See, here same regular QRS, but here one this and this changes will be there. These are why broad QRS means they are conducting through muscle. Okay, so next there is WPW syndrome. Here this is P, this QRS, P or interval, it is shortened. There is a delta wave. P or interval is shortened. This is a delta wave. This is QRS. Okay. This ARVC. What do you mean by ARVC? So ARVC is arrhythmogenic right ventricular cardiomyopathy. Okay. So we have to see mostly V1, but in V1 this QRS will be like below, right? So it's okay. If it is below also, here main is there is a here delta wave, here epsilon wave. Okay, there is a positive deflection after QRS. See, this is epsilon wave. After deflection, there is a positive wave. So mostly we can see T wave inversion. We can also find like that. Okay, if it is in V1, is a QRS, then it's a positive deflection like this, then T wave inversion. So this is also ARVC, that is arrhythmogenic right ventricular cardiomyopathy. Thank you guys. I guess you have understood something, right?